Hey everybody, what's up? It's Dr. David here with El Paso Manual Physical Therapy, and we're going to be covering the top 10 fastest ways to relieve back pain. I'm setting up my live stream here, making sure Instagram is running. Looks like it's about, there it goes. We are live on YouTube, on Facebook, and now on Instagram as well. You guys can ask me questions, so drop a comment in here. I can't see your comment though if you're on Instagram, but Facebook and YouTube, yes, I can see your comment. Looks like we have a new member, Jim Lumbra 3904. Hey, welcome to the YouTube channel membership. We have a channel membership, by the way, in case those of you guys are wondering. You can join the YouTube channel membership to get your questions answered a bit faster if you leave a comment on one of our videos on YouTube. So it's a little bit different than we have programs on our website. That's a little bit different. Some of those are memberships too, but that's not the same thing. Just in case you guys might be wondering. But anyways, so I have 10 things for you that are the fastest ways to relieve back pain, and these are going to be in order of things that relieve your pain quickly to things that will relieve your pain not as quickly. So that's what I mean by fastest, like they're basically fastest to slowest. However, I'll highlight along the way which ones are most long-term, like which ones are going to give you the best long-term relief, and which ones I like the most. So if you have questions, start dropping them in the chat, and I'll take questions, of course, as we go along. But I'll be talking through the video. I'll be talking through all these points. So let's get going with this. The number one thing that's going to give you some quick relief for back pain, get my marker here. This is my favorite, and you can get pretty instantaneous relief. Like within seconds, you can start to feel better. It is a massage gun. And there's a specific one that I like, a style. Is it right over there? I think it's right there on this. Let me show it to you here. This is a swan neck massage gun. Thank you. So let me just explain this real quick. You have probably seen massage guns that look more like this. That's what I love about this one, is you can convert it both ways. So you've probably seen massage guns that look like this, and this one works just fine this way. Turn it on, you can put it on your body and your, wherever you need to loosen up stiff muscles. But it's got this swan neck attachment so that it makes it really convenient to reach your back, because you can reach your back with a normal style massage gun. However, it's awkward on your shoulder. You have to kind of, get it just right. But with this baby, maybe we can get it on. I'll reach up a little bit higher. There we go. It's on. You can just reach over to your back this way, or turn the handle in your hand and reach onto your back this way. And my advice to you is hang out on the muscles that are tender and stiff in your back, and don't make it hurt more. Make sure that it's relieving the spot. Now, you might get some increased pain initially, like when you find a spot that's tender, you might be like, it hurts in that moment. But as you keep it there for just like 5 to 10 seconds, you should feel that it begins to relieve the spot. It begins to soften up the spot. What's happening when you do that is the muscle gets tense and tight because it's being overused. And then when you have the massage gun tenderizing it, essentially, you loosen up the muscle and it starts to become less tight. And when you have a less tight muscle, it's putting less compression through your spine. I have my spine model here. The muscles, this is the back of the spine. The muscles are right here on the either side of these things. And so you're putting the massage gun in the muscles right there between the two spinous processes right there. And if you get to those muscles to relax, then what's going to happen is you're going to allow the less compression in the area, because when the muscles are not relaxed, when they're working really hard, it compresses everything. The muscles squeeze down and it puts pressure on the discs and on the nerves as well. So I hope that makes sense there. Real quick, can you guys just let me know that you can hear me? Let me know if you can hear me, and then also let me know where you're from. Drop a message in the comments if you and just make sure that my mic's working here. So I'm not getting a lot of comments. Oh, Valerie said she just purchased the massage gun. Cool. So hopefully you're hearing me, Valerie. And then we got a question from Lise, looks like Lishab 84. I'll tackle that one in a second. but let me know if you can hear me. Great. Valerie says, I can hear you from Nova Scotia, Canada. Great. Mary Ziegler says, I can hear you. Fantastic. All right. And you guys are also telling me where you're from already. Awesome. Slovenia's in the house. Majajamnik. And then we have good day from Melbourne, from Margathia, Long Island, New York. Hey, Janice. Great. Thank you guys so much for letting me know you can hear me. Lee Shab is in Illinois. We have Pat Owen from Finger Lakes, New York. Mark Alexander says audio is good. Fairborn, Ohio. I have that massage gun. It's great. Yeah, it's an awesome massage gun. Baton Rouge, Iberville Parish, Mimi Nuong. I can't pronounce that. Sorry. Can hear you from North Carolina. Awesome. You guys are with me. Fantastic. Hi from Vancouver, Evie. And we've got one more here from Massachusetts, Gina. Hey, Gina. Thanks for joining us in Massachusetts. Lori Wilson, I see you from Ohio. Great. Awesome. So, guys, number one is the massage gun. I put this one up here because it's natural. I mean, it's natural as far as you're not putting things in your body. You know, you're not dealing with side effects of medications. It can give you some pretty instantaneous relief. The thing is, you have to keep using it. This is not going to fix your back pain for the long term. This is very short term. But if you can get good at using this, it sets you up to begin to get long-term back pain relief. You just have to work with it a bit. You have to kind of figure out when should I use it? Maybe in the morning, maybe in the evenings. If you're more active and your back starts to act up, that's a great time to use it as well. But I think it's going to do you a lot more good than just taking like pain medication. I'll talk. It's on the list here. I'll tell you when here in a second, because it's impacting the mechanical aspects of your body, which are going to directly influence your discs, your nerves. You know, things like stenosis, the joints themselves in the spine where you might get arthritis. So huge win is get a massage gun and begin to use that. All right, let's talk through number two here. And some of you guys are already doing this, stretches. Now, when it comes to stretches, I'm going to head over to the table. There's all different kinds of stretches that you might do. And there's some specific ones that I tend to guide people towards. However, come on over here with me, guys. I'm not stuck on, you know, you have to do this one or that one. I think at the end of the day, you just have to make sure that you feel looser in your back, that you feel relief of tension, muscle tension, and pain in your back. At the end of the day, that's most important. But just to quickly overview some stretches, a figure 4 stretch is a very common one done for the back, where it's more for like pain in the lower back, hip area. But you'll thread your hand through the needle here between the legs, pull your knee up. You can turn your legs over this way. You could just straighten out your leg and twist your back this way. Knees to chest is a really common, easy one. You can cross your feet or not. There's versions where you're on your hands and knees, and I like this one a lot, where you're bringing your bottom towards your heels like a dog or a cat. I call this a hand to heel rock, or some people call it a quadruped rocking maneuver, but people will feel a nice little back stretch right here. Some people will get in this position and then thread the needle this way. They'll put their arm under their other arm and body and twist in their spine, and they'll go both directions. And then as far as holding or repeating the motions, I don't think there's a hard and fast rule as to, you know, if it's right or wrong. I'm a big proponent of don't hurt yourself. Whatever you want to do here on stretches that don't increase pain, and that's good. And then the other thing is, I would not hold a stretch for, let me say it different. I would not hold a stretch at a high intensity. So on a scale of 0 to 10 intensity, 10 meaning you're about to tear something or hurt yourself somehow, you should be down to like a 2. Maybe a 3 at most. 1, 2, or 3. And that range is where you want to feel a stretch, because you're going to not activate muscle reflexes. If you do a really intense stretch, like if I'm stretching my bicep right here, I have bones that are going to block it. The elbow locks at this position. But if you were to be able to go farther, the muscle itself would start to want to contract to protect itself from being overstretched and becoming injured. That happens in your spine. So you want to avoid intense stretches so that you're not stretching against your muscle contracting. If you stay in that 1 to 3 zone when you're doing any kind of stretch for your back, it tends to be the most productive overall. And here's the thing though, is you can't rely on stretching to fix your back problem either. It's only going to give you short-term temporary relief. The first half of this list is going to be short-term temporary stuff. But you might try this out, if you're considering using pain medications or doing something that's going to, potentially have side effects. I would go with these two first and see if you can get an improvement with just that before going to pain medications so that you can loosen up the joints, loosen up the muscles, and this might help you sleep tremendously better. And like I said, with the first one, it sets you up to do the long-term pain relief stuff, which I'll get to in just a minute. Number 3, and then we'll answer some questions. Back brace. A back brace. Now, I don't have one with me. We actually gave away the last one that we had. But you've seen these. They're like the oh, it slips me. What's the thing that girls wear? I want to say tourniquet. It feels like a tourniquet a lot of times. The corset. That's right. Thank you. The corset-looking devices that you strap on, usually with Velcro. They might have some elastic on them, like some elastic strings, or it's like neoprene, it's stretchy material. And the idea is it's compressing you in your waist, in your midsection, because it's giving your spine stability. Oftentimes this can help, but it's still short-term. It's not something that you should rely on long-term. And here's the problem that I run into with people using these, is especially if they get recommended by a doctor, some sort of healthcare professional, to use a back brace, they often don't get told when to stop using it. They just get told, use a back brace, and that's it. And what's missing oftentimes, the part that I want to give you, is use a back brace, and if it gives you relief, continue to use it, but you have to get the muscles to activate a certain way so that you can wean yourself off the back brace. That's a plan, not just like, let's just use the back brace indefinitely, because that's a bad plan if that's your long-term plan. In the short term, you want to get off the back brace, but you can use a back brace, and that might be a good alternative from using medications, going for injections, and then ending up in a situation where you might need surgery. So make sure that if you use the back brace, you have an understanding that I'm eventually going to have to get off of this. Then you'll be okay. And as far as timeframes, I have seen people rely on back braces for months on end. What I typically see happen is after 2 to 3 weeks of frequently using a back brace, people say that it stops helping as much. At that point is when you should be using your muscles a lot more. As soon as you start with a back pain problem, you should be activating certain muscles. It's coming in the list. But if you decide to use a back brace along with this other stuff, you need to start thinking, I'm going to get off the back brace eventually. Just have that in your head, and it's okay to rely on it for a few days, maybe a week at most, but then eventually you want to start wearing it less and less till you're not wearing it anymore. So make sure that you have that right thinking about it. All right, let's answer some questions here and see where else everybody's from. I have people helping me out with my lost word, girdle. Thanks, Tamara. Yep, that's another one for sure. All right, let's answer that question that I saw early on. Here we go, from Lishab 84. Hello, I've been struggling with lumbar stenosis and hip pain. I'm so sorry, Lishab. Docs want shots and nerve ablation. Can I actually get better through physical therapy? How often do exercises to make better? Great question. So sorry that you're struggling with this problem with stenosis and hip pain. Very often it's a muscle imbalance. And yeah, the doctors, their procedure is, let's try pain medications. And if that doesn't work, let's try injections. If that doesn't work, let's potentially do surgery. And sometimes they'll try like a nerve ablation procedure. A nerve ablation, by the way, for those of you guys that don't know, they're using needles to go into the areas where the nerves are, and they're burning the nerves. So they're hoping that they'll just shut off the pain by burning the nerves, but it doesn't fix the root problem. And in fact, it might even affect muscles that nerve connects to, and you can potentially lose function or partial function in some of those muscles, and it sets you up to not be able to recover to fix the root problem, to recover from the issue long term. So I would highly caution against getting a nerve ablation procedure done. I would rather you not personally. But if you're fixing the root muscle imbalance, people tend to make big improvements, and you're not even thinking about getting a nerve ablation procedure anymore. Yes, you can get better by doing the right exercises. I just also worry about where are you doing physical therapy? Who's guiding you through it? Because if it's a physical therapist that's usually working with people that have had a back surgery, they're probably going to make you do exercises like somebody who had surgery. And if you haven't had a surgery yet, you're thinking about potentially having one, but you're trying to fix it now, you need to make sure you go through the treatment that's fixing the root muscle imbalance, not just repeating exercises that you would do after having a back surgery. That's not very wise because it's a different process. If you just had back surgery, you're doing little baby movements, you're trying to gradually bend your spine more, you're recovering from surgery, you're rehabilitating from incisions, potentially hardware like rods and screws that were put into your spine. And that's a whole different rehab process than somebody who has not had any of that done, no cuts on your back, no hardware inserted. Then we have to figure out how muscles are firing and which ones need strength, and exercises are going to look very different. So just be mindful of where you're going to go get physical therapy. If you're doing the right kind of physical therapy, you can absolutely make this improve tremendously. Now, with stenosis, it can be so severe in some cases, and with hip pain too. Like if you have severe hip arthritis, it's end stage, and you have locking movements, there might be a situation where you do need surgery. But if you have decent motion, like if you can bring your knee to your chest, and and even though it hurts, you have the ability to do that, then your hip's moving pretty well overall, generally speaking. If your back has decent movement in it, even though it hurts, then you probably have the ability to recover just fine without surgery. So with the information that you gave me in this comment, Lishab, that's what I would say. As far as how often do the exercises, it's dependent on you, because it's going to be different from you to somebody else with the same problem. It depends on how much you can tolerate, how much exercise you can do to make the right muscles burn without increasing pain anywhere. Let me say that again, because that's very important. How much exercise, how many reps and sets, and how often do the exercises depends on what you can tolerate to make the right muscles fatigue or burn without creating any sort of pain or uncomfortable sensations that leave you feeling worse later on. Besides muscle soreness. Muscle soreness is okay. We need that. You need to get stronger in the right areas. Okay, so for you, that might be 10 reps today. It might be 100 reps. It depends on your prior fitness level, on the severity of your back and hip condition. You have to look at all that and think it through. I hope that helps, Lishab. By the way, great question. I bet that helped a lot of people. I'm going to answer this one question, then we'll get into the next thing on the list. I can't pronounce your name. I am Abish Ekundu. I've got of condylomalacia patella grade 3, so can I use a massage gun to quads, and for how much time is it safe to use? Yes, you should absolutely use use the massage gun on your quads, because if you have condylomalacia grade 3, you probably have overdominant quads. And the same thing that I'm talking about doing for the back here, where you're freeing up the back muscles, you should be doing on the front of your thighs, on the quads right here, because that loosens the muscle and reduces the pressure at the kneecap, where you have condylomalacia patella. That can give you some immediate relief, but you still have to figure out how to fire the right muscles so that long term you're not overusing your quads. And it's up to you on how long you use the massage gun. However, you should be thinking, let me give you this recommendation. Usually after about a few minutes, 3 to 5 minutes on one leg, you get diminishing returns, meaning you're not going to get that much more improvement. You can still go. You could go 10 minutes, you can go 20 minutes on one leg with the massage gun, but you have to determine, is it worth it for you? Are you getting that much better by using it for that much longer? What I generally instruct people to do is use it every few hours. Use it several times a day. And if you feel more stiffness and tightness in your thigh muscles, especially if you were more active, like if you went on a walk, if you had to go grocery shopping and it set off your problem, if you were exercising and it set off your problem, use this more. I hope that helps. All right, let's get into number 4 on our list here. Hanging. All right, so what I mean by this, and I don't have the devices here because they take up too much space, an inversion table where you're hanging upside down. I've done videos on this recently. I don't know if they've posted yet. But like the ones you see in chiropractic offices, they're available for home use where you clamp your feet in and the table starts to tip upside down. That puts distraction through your spine. That would be like the probably the most memorable way the way that people think of it when we think of hanging. But you can also hang from a pull-up bar. So if we had our pull-up station here, you can grab that bar and just let your weight sink down, and that starts to stretch out your spine. And as long as you can do this in a way where you relax and just hang, then it does a lot of good for the spine. Let me show you on the model here. Your spine is usually compressed here because the muscles are acting too hard on it. But when you either hang upside down or you hang from your arms from a pull-up bar, you're going to take some pressure off. Now, this is short-term pain relief. However, if you're combining this with activating the right muscles, you can get some long-term relief. But for people there's a good group of people, I'd say a third or so of people with back pain problems that benefit tremendously from hanging. And when it comes to how much to hang, if you're going to be hanging upside down on a inversion table, usually a minute is plenty. And you don't have to go straight vertical upside down. You can go at an angle, like 45 degrees, 60 degrees, somewhere in that range is usually quite a bit. You're already feeling a good distraction. But if you decide to go full on vertical, it might feel like it's improving, like it helps you a little bit more. Personally, I prefer the pull-up bar, the hanging station. And the reason is because it works your grip, which a lot of people don't have enough grip strength. You don't have to hang upside down. It's uncomfortable to hang upside down. Like all the blood rushes to your head. If you're stuffy and you have mucus, all that goes into your sinuses. You feel your body just, hanging. It just isn't a normal sensation for people. So it's not my favorite. Plus the device itself kind of takes up a lot of space and it doesn't have another purpose besides hanging upside down. Whereas if you had a pull-up bar, you can do pull-ups, you can do exercises from it. You can hang like rubber bands and do a bunch of different exercises. You can look up all kinds of exercises to do from a pull-up station. But hanging for back pain relief, if you have back pain problems, could be a massive pain reliever for you that is all natural. So far, everything here, you're not putting anything in your body. So that's why I like all of these. If you're dealing with a back pain problem, these are 4 solid options for you that you can cycle between, do 2 of at the same time. One might not work for you today, but another one will. And then next week, you can come back to one that wasn't working for you. I think that's a solid game plan to get through the initial severe pain that somebody might be going through for a herniated disc, degenerative disc disease, back arthritis, sciatica problems that are associated with a herniated disc. These are pretty awesome early phase exercises or treatments to do to get some back pain relief. So there you go, guys. Number 4 was hanging. Number 5, let's make sure I don't miss anything. Pain medications. Now, I usually am telling people to stay away from this, and I still agree that it's not a good idea, but think about it. If we're talking about how quickly you get relief, pain medications will take 10, 15, maybe 20 minutes to take effect. A massage gun, within 2 minutes, you'll feel relief. Stretches, as soon as you've done the first stretch, you can start to feel relief potentially. With the back brace, it's almost instantaneous. As soon as you put that brace on, you feel that support, and it can give you some pretty quick relief. Hanging, also pretty, as soon as you hang, you get some relief. The trouble is, all of these are a little bit more active. Like you kind of have to work on it. You have to go purchase things for the massage gun, for instance, and for the hanging and back brace. For the stretches and the rest of them, you have to kind of figure out how to use them. So there's a bit of a learning curve with all this stuff. This one is the most convenient. You just take a pill. Very accessible. You can get over-the-counter pain medication. If you need the high-power stuff, you can probably go to the doctor and get pain medication. You can do telehealth doctors these days, and they'll prescribe you medications you can go pick up at the pharmacy nearby. And the thing is, it has to go through your system to take effect, so it takes a little bit longer than all these other ones, but almost no learning curve besides learning, how the dosages work, because some you can only take so frequently. But lots of side effects, potentially lots of side effects. I mean, some people are really sensitive to ibuprofen. It can upset stomachs. By the way, I need to say this to you guys. I don't think I've ever said this on a live before. Ibuprofen is seriously dangerous for some people. And here's why. It stops inflammation. It's an anti-inflammatory drug. It's in the family of NSAIDs, which stands for non-steroidal anti-inflammatory drugs. And so it's in the family of naproxen, diclofenac, ibuprofen. There's another one. There's a bunch of them, but those are probably the more common ones. Your inner lining of your stomach is very important because it regenerates really fast because it's holding stomach acid. When you have stomach acid, it's breaking down food. It's designed to break things down, even meats. So it actually breaks down the inner lining of your stomach, the acid itself. But your stomach is designed to regenerate itself faster than it's being destroyed by the stomach acid. It's part of an inflammation process that it has to go through. So if you take ibuprofen and you're halting the inflammation process, it doesn't just happen where your back hurts, it happens all over your body, including your stomach. So there's a high risk that you can create a hole in your stomach because the acid burns through it because you're not healing as fast as you should. Inflammation is a first step in healing. And so it needs to happen. But these medications can help with inflammation. We see it as a bad thing, but it's the first step in healing. But some of these medications can temporarily stop healing, but as a side effect, you're going to potentially get stomach problems. That's the number one problem that people run into with ibuprofen is they get stomach irritation. And then if it keeps going long enough, if you keep using ibuprofen long enough, you can burn a hole in your stomach and end up in the hospital with stomach acid leaving your stomach, and that starts to destroy your internal organs. Some people will die from this. More people die from ibuprofen overuse, problems from ibuprofen, than a lot of other scary things like shark attacks and lightning strikes. The things that people get worried about, they don't kill you nearly as often as over-the-counter ibuprofen use for simple things like back pain that really you should be doing all this other stuff for. But I put it on the list because in a pinch, you're not going to run into major problems if you use ibuprofen for a day or two. It's a problem when you start using it around the clock for weeks on end. That's when it's a serious problem. Some people are very sensitive to it, and they'll have an issue the first or second pill they take. And I think that's a blessing in disguise if that's you. I think you should say, hey, ibuprofen is not for me. Let me figure out the other natural things that I could do to solve this back problem or wherever you're hurting. All right, so I hope that helps some of you guys. Just be careful with ibuprofen and other Tylenol too. Tylenol has side effects. Like all the pain medications out there have potential side effects. What I would wrap into this as well is topical pain medications like the creams you can rub on, like Bengay, Icy Hot, Arnica Gel, Tiger Balm, Blue Emu is another one. There's a bunch of them. If you go into the first aid pain reliever department at the store, you'll find a wall of different kinds of patches you can put on too, like lidocaine patches. They all go on your skin. You don't swallow anything. They're still being absorbed by your body, so there's potential side effects, but it tends to be lower risk side effects than if you're taking medications. And as always, talk with your doctor in person, your physician, about use of pain medications because there might be interactions with other things you're taking. There could be problems with supplements you're taking as well, interactions that you don't want side effects to. You see all the disclaimer. I feel terrible about this, guys. I just felt like I gave you a big old long disclaimer for this one thing that everyone goes to for back pain. Y'all should be sticking to this stuff. Let's hang out there. All right, let's get to number 5 here next. Change up the colors here. I feel like we need to get off of pain medications for a minute. Number 6. We're on the good stuff now. Now we're making some serious changes here. Lower abdominal activation. I'm just going to abbreviate that. Lower abdominal activation. Here's what this means. Your lower abdominals are below your belly button. So my belly button's right here. I've got my finger on it. Above that are my upper abdominals, and below that are my lower abdominals. When it comes to lower back pain, consistently, I find that people don't have good activation of their lower abdominals. When they think to tighten up their abs, it tends to come from above the belly button, and they're missing the lower ab activation. And you have abs in both areas that attach to the back directly, and they attach to the rib cage above and the pelvis bones down here. And their connections to the pelvis bones and the rib cage influence what's happening in the back. Because if I suck in my abs and get my lower abs to activate, you can see what happens here is I slouch a bit, my rib cage comes down, my pelvis comes up, and look at my back. I'm curved here. Let me get in the right spot. That's probably the better spot right there. But when I suck in my abs the right way and I get my lower abs to activate, my back curves less. And what that does is it stacks my bones on top of each other better so that the pressures are distributed better, the way that they're supposed to be in the spine. If your back is really, really curved because your lower abdominals aren't doing their job, your tummy's sticking out right here, then your back is going to curve excessively and put certain muscles in a position to fire too much, to start to over pressurize the spine, the discs, the nerves, and everything in there. And over time, this sets up herniations, pinched nerves, osteoarthritis, stenosis, spondylolisthesis, all kinds of back problems that you don't want. So in order to fire your lower abdominals, to activate them, as I wrote on the wall here, is you have to get them to tighten up down here. So you might be able to do this in standing by just sucking in your abs. You might feel that they tighten up. You can poke down here, like right above your hip bones where it's hard right here. You go inwards a little bit and up, and that's where your lower abdominals are. And you should feel like when you suck in right here, they get firm. You can't poke through them very easily. Now, if you have trouble in standing, let me show you in lying down. That's how I usually start people. So I'll have them lie down like this. I'll tell them to bend their knees because it just sets them up better. Then I'll have one hand under the low back, like right above the tailbone. And then I'll tell them put the other hand below the belly button where your lower abs would be. And then you're going to think about smashing your back down into your hand. So I'm thinking about putting pressure on this hand with my back by smashing my back into it. This is tricky for some people. Some people get it really fast, but other people, they're like, what is going? I can't quite do that. That's a coordination problem that you need to solve. Otherwise, you're not going to get your back pain better. You're going to be stuck in doing short-term pain relief things, and you're never going to be able to get to the long-term pain relief things because you can't get your abs to activate. This is an important milestone that you have to go through. Otherwise, you won't resolve the back pain problem for the long term. So if you're having trouble, what I recommend is go the opposite motion. So I'm telling you to flatten your back, try arcing your back as much as you can, or another way to say it is stick out your butt. And then once you go as far as you can that direction, now go the opposite way. And play with the motion where you arc your back, flatten your back. Arc your back, flatten your back. Stick out your butt, tuck your butt in. Stick out your butt, tuck your butt in, and get comfortable with this motion here. And then what you need to do is rest in this one, where you're tucking your butt in and flattening out your back. As you push that down, you should feel like your lower abs are activating. Once you have figured this out and you can consistently do it, not only in lying down, but in seated. I'm doing it right here. Sucking in my abs. And you can see what happens up here is I subtly slouch. I kind of lose my good posture. Just made a video on posture, and I disagree. I don't think posture is something that we need to be pursuing when it comes to back pain. I think we need to be pursuing proper muscle activation and strength, and that indirectly gives us good posture. But you can see when I suck in my abs here, I'm firing my muscles properly. I'm giving my low back good support, and I'm technically not in good posture as society would have it. But it's healthy for my back. I feel good doing this. Right? So once you can do it lying down, then seated, then you have to go to standing, and you have to be able to do this in standing. And the trick, here's the $1 million tip for you guys, is you have to do this all the time. It needs to become a habit for you, where you are tightening your abs as a default. Most of the time, your lower abs are subtly firm. They're held As if somebody were to like gut check you, like punch you in the abs, and you're gonna brace to take it. You should be braced in your lower abs like 10 to 20% all day long. That would solve a lot of back problems out there. We could stop the video here and you guys would be, a lot of you guys are not going to have surgery if you implement that. A lot of you guys are going to have zero back pain moving forward, but you have to brace the abs on a low level for most of the day, 70, 80%, 90% of the day. I'm not asking for perfection. I'm asking for an improvement, a significant improvement from where you're at, because chances are you've been at zero, no lower ab activation, maybe some upper ab, but no lower. And it's not enough to be at 10 or 20% ab activation. You have to climb up past 50 into the 60s, 70s, and 80s. And if you can figure that out, you're on your way to feeling tremendously better. All right, let's get one more here, and then I'll start answering some more questions for you guys. This one goes along with the ab activation. Glute muscle activation. Similar to ab activation because they work together. Let me show you this side view of my body again, just so I can highlight this. But remember, I was doing this sideways, look at the curve of my back thing here, where you can see I'm kind of sticking out my butt, accentuating my curves in my back, my lower lumbar lordosis, my lower back curve. If I suck in my abs, by default, my glutes also want to activate. So you might be feeling that if you're trying this motion in the video with me here right now, your butt works with your lower abs. They're supposed to work together. If we think about let me bring the skeleton over so you guys can see this here. Let's not get a blooper live. All right, we're safe. You think about the abs, they work right here, and the lower abs are in this area. They attach to the rim of the pelvis bones right here. When they tighten up because of their attachments up here, they're going to pull this bottom part of the pelvis upwards this way, and then the glutes are on the back of the pelvis. When they activate, they pull the backs of the pelvis downwards. So you see the front of the pelvis tip up and the back of the pelvis tip down. When the two muscles tighten up, they work together. And when they tip the pelvis that way, it straightens out the lower part of the spine. So that's why you see less of a curve down here. So let me show you one more time on myself. Now that I've just explained that. Abs, lower abs right here in the front activate, and then the glutes activate back here, and my curve straightens out because I've tilted my pelvis forward. We call this, backwards. We call this a posterior pelvic tilt. You don't need to know that. Just fire the right muscles. Worry about that lower abs and the glutes, and it'll get your spine in the right position. So if you can't fire your glutes right now, because here's the level you have to get to, you have to be able to fire one glute at a time, left from right, and do it while you're walking. Because when you put weight on one leg, the glute on that side should activate. And then when you step to take a step while walking, your other glute should activate. You need to relax this one. So you have to have the coordination to fire the left and right glute independently of each other while you're walking. And you have to have the concentration and the coordination to be able to control how intense you fire the glute on each side. And then the big hurdle that a lot of people have to overcome is, you might have this, when you think to tighten up your glute, try it right now, tighten up your glute, other muscles in your thigh also fire. That's not good. This is why number 7 on this list is so important, because if right now you're in a situation where you fired your glute, you intended to fire your glute, and a bunch of thigh muscles went off, what's happening when you go do a glute exercise? It's no longer just a glute exercise, it's a thigh muscle exercise. And that's not good for retraining these muscles to fix the imbalance, because you're going to be training thigh muscles potentially more than glutes. Big problem. When you go even just walk, you're going to potentially use a bunch of thigh muscles when you should be using your glutes. You're training yourself inappropriately, and that's tilting your pelvis wrong and slowly putting increased pressures in your spine, in your discs, in your nerves, all the bones, all the ligaments and tendons in the area. And that's how you develop this stenosis issue, or this herniated disc problem, or this degenerative back problem. You have to fix these pressures. All right, so practice glute activation just in standing. Be able to tighten the glutes with the abs, tighten just the left side by leaning over to the left a little bit, tighten just the right side by leaning over to the right a little bit. Practice it in sitting. You should be able to sit and tighten glutes. Just tighten one side, tighten the other side, quiet the thighs as you're tightening the glutes. And then you could also practice it in lying down. I would encourage you to get obsessed about this. Practice the abs and the glutes together. Tighten the glutes here, get the abs engaged here too. You see how I straighten out my back by flattening my back down into the table here, but my glutes are also active and thighs are relaxed here. You can do it with your knees bent as well. You can think about tightening just one side, tighten the other side. Eventually we can do more advanced glute exercises, but the biggest milestone most people struggle with is just activating the glutes to begin with without thighs going crazy, and then activating left from right. So figure that part out, guys. It's going to be massively beneficial to you guys for solving back pain problems. People think that it's just the back and that they forget glutes. I'm talking about healthcare professionals. They forget how important the glutes can be in solving back pain problems. They just focus on training back muscles, which I have a side rant for you guys here. Why train the back muscles? Let me pull the skeleton in again. If we're to look at the spine here, you have glutes down here, you have the spine back muscles that run up in here, and the superficial thought that healthcare professionals get taught in school and kind of hang on the rest of their careers whenever they're helping patients with back pain problems is that these back muscles are weak and therefore they should be strengthened in order to solve a back pain problem. But in reality, they're the muscles closest to the problem. And when they get stronger, they add more compression to the back. They actually mess your back up. They're in a position to add severe pressure to your joints and nerves. So I tell people, actually don't work them out. Don't do any sort of back exercises. Don't do any back bends. Don't do anything that is fatiguing, tiring out these back muscles, because chances are you're going to gradually feel worse. Some people feel worse immediately. Some people feel worse as they continue to exercise over days and weeks. I would highly advise against it. Instead, focus on those lower abs and the glutes. Don't do bird dogs. Don't do Superman holds. Don't do swimmer exercises. Stay away from those, please. Should we answer some questions, some comments? Let's do it. I'll come back to the list here in just a moment with number 8. Let me just remind myself. Maybe you guys can guess what the S stands for. All right, who's next on our questions here? We have, I answered, I am Abish. Where are you guys here? I am Abish has another one. Oh no, this is the same question about the massage on the quads. Okay, who's next here? Toes, fingers 20. Hi, wonderful Dr. David. Thank you again for your knowledge and time. You're welcome. Absolutely happy to help. Bob and Diane from Saskatoon, Saskatchewan. I need help with psoas muscle, which gives sharp pains. Oh, this one might help on the psoas. So it's going to be hard to get directly into the psoas because you have to go through your stomach, but go a little lower on the top of the thigh. It's freeing up your thigh muscles, especially the upper part of your thigh with a massage gun. And I would take off the swan neck if you have the swan neck attachment to get right in front of your thigh. And that often will relax the hip flexors so that you can get some relief, because the overactive hip flexors can feed into back pain for sure. And it has to do with weak glutes. If you have weak glutes and weak abdominals, that's what I was talking about here, other muscles start to compensate. Back muscles are the main one, the ones that I was highlighting on the back, but hip flexors are number 2. And hip flexors attachments, I'll show you here on the skeleton. They attach at the top of the thigh bone right here, and then they run upwards and attach to the vertebrae of the spine, the lower back. And so because they run up and down right here, if they start to activate a lot, they can be super compressive. They can add a lot of compression forces to the lower back. So you don't want to have overactive hip flexors. You need to be using your glutes enough so that your hip flexors don't feel like they need to take over. They don't feel like they need to compensate, but it comes from strong enough from adequate strength in your glutes and abdominals, because they're all neighbors to each other. They're all in the pelvis hip area. But if you are not using your glutes or abs enough, hip flexors will take over and add more compression to your spine. And then you'll feel like you have that hip flexor stiffness, hip flexor tightness. And people always want to, free it up and use devices and tools to free it up, but that's just short term. You need to fix the glute strength and the abdominal strength to get long-term relief from these hip flexor problems. Great. Comments on breathing, please. Absolutely. I love breathing. Don't we all? If we're not breathing, that's not a good thing, right? Here's the thing with breathing is you should be breathing from your stomach at rest. This is a big deal, okay? Because a lot of people don't breathe from their stomach, they breathe from their chest. So if you look at me right now, you can see my chest, you can see my abs here. What should happen is this part of my abs, let me take the comment off so you can see better. When I'm breathing at rest, let me show you from the side, it should expand from here. Even my lower abs here. See how that moves down here? Because my diaphragm, which is the main breathing muscle, is at the bottom of my rib cage right here. So that diaphragm is going to move up and down as it works for me to breathe. And my abs should be moving in and out as my diaphragm is pushing things up and down right here. That's normal resting breathing. It changes if you're exercising and you're having an increased breathing rate. But at rest, I see people breathe from their chest. And this part will rise and fall up here. That's not good. That's going to change the way your shoulders work, your neck works, even in your lower back. So what you have to consciously do is practice stomach breathing rather than chest breathing. Now, ideally clear up any allergies you have. If you're dealing with a cold, that's going to temporarily change things, obviously. If you have some sort of respiratory problem. But if you're healthy otherwise, you should be breathing from your stomach. Practice that. And for those of you guys that are struggling, it's going to feel awkward and weird because if you've potentially not been stomach breathing for years and years and years, and that's how it should happen. So it's going to feel weird at the beginning, but you have to get used to stomach breathing at rest until you have to practice it consciously until it becomes a normal sensation for you. Then you'll feel a lot better. You'll get rid of a lot of pains too. People have small aches and pains that happen in their neck and shoulders that are related to the way that they're breathing. All right, next one here is Ann Garcia. Always, Ann Garcia from Ohio. Hey, Ann, I remember you. Pat Owen says, posture, question mark, exercises. I don't think posture is a big thing to worry about. A lot of people say, well, you should have, tall posture, stick out your shoulders, stick out your chest, pull your shoulders down, neck high, chin high. That's all baloney in my book. Here's why. How many of you guys can hold this perfect posture for minutes, more than a few minutes, hours? You get tired. And as soon as you stick out your chest, think about it. Good posture, it makes me arc my back more, which makes me use my back muscles too much, which feeds into this imbalance that I'm talking about. You're not using your abs or your glutes very much in that good posture. The purpose of that posture is more, in my opinion, body language driven. Because think about the situations where you're told to have good posture. Your parents might tell you this. If you're in the military, they're going to have you stand in a certain posture. And that's important for the physical presence, for the physical toughness that you're supposed to portray body language wise if you're in the military. For your parents, they probably want you to be confident. So they want you to stand up tall so that you appear confident, and hopefully you'll also act truly confident. If you're in certain performance sports like gymnastics, you might have to do your flips and then land and have a certain pose. If you're in modeling of some sort, you might need to have a certain pose as well. And posture then becomes important. But if we're talking about fixing a back problem, we shouldn't be talking about posture, in my strong opinion. We should be talking about this stuff. Fix the muscle imbalances, because if you do that, usually your body will, at rest, without you having to consciously think about it, you will settle into the posture that your body should be in without having to consciously think about it, because that's a big deal too. Posture should be subconscious, not conscious. You shouldn't have to stress yourself out every moment of the day thinking, am I in good posture? Are my shoulders right? Is my neck right? Is my back right? How are you going to live? How are you going to focus on work or school or whatever you're doing? Relationships, if you're just constantly thinking about the position of your spine rather than thinking about the things that you're in, things that you're doing. So it's a big distraction, in my opinion, to worry about posture to fix your back pain. Not a good use of your time or energy. I would rather you work on the muscles, the right muscles that I've listed here on the board, and do this in the short term so that you can fix the back pain problem for the long term. And I I can tell you from personal experience in working with patients over the years, initially my first year of practice, I talked to patients about posture because I got it in school. I was, I was figuring out a lot of this stuff. After that, I stopped and I never looked back. I have the only time I've talked about posture is when patients have brought it up to me and I've told them some version of what I'm telling you right now. Stop worrying about it. Worry about the right muscles. And then they follow my advice, the ones that chose to follow, which most of them, there was that one or two that didn't like what I had to say. But I said, you're on your own then, because this is what I have to say. And all of them got better. They all got better without worrying about having great posture, sticking out your chest, shoulders the right way. I get told I have good posture often, and I'm not trying. I work on the right muscles. So I can rant all day about this, guys, but posture, Pat Owen, don't worry about it. I'd rather you work on the exercises, the ones that I'm telling you about, abs, lower abs, and get your glutes active. All right, let's see if we can get one more question in, and then we will wrap up this list for you guys. Hello from Mojave Desert. Awesome. We have Mulir Bellator from the Mojave Desert. We have Asuzik. It says, thank you, Doc. Cool. Lewis Simon says, hi from Kansas. Awesome. Kansas is here. Rini says, I prefer PT before meds and injections. Yes, I agree, but the right kind of PT that's working on the right problem. You need to find the PTs that are not working with surgery cases all day, because they're going to probably have you do surgery type exercises. And if you're trying to avoid it, not a good thing to be doing surgery, post-surgery exercises if it's not for you. Myrtle Beach is here. Hey, Bonnie Noble. And then Helen Kingsbury says, where are you? I'm right here. I'm in El Paso, Texas. My favorite place in the world. I love this city. All right. Mulir Bellator says, at grade 4, which is like a D grade osteoarthritis. I'm so sorry. I hope to follow the plan to prevent hip surgery. Yeah, you have no idea, Mulir Bellator. There's so many people in our hip arthritis recovery program that have been told they have bone-on-bone, grade 4 hip osteoarthritis, and they are doing phenomenal. They're doing great. They're walking for longer distances. Some of them have no pain. They graduate from our program, and they're back to life as usual without ever having surgery, following a plan similar to this, but this is more tailored for back pain. But it's all laid out nice and neat in our hip arthritis recovery program. Go check it out on our website. We've got phase 1 for free if you want to try it out and start getting some pain relief today. Canada's in the house. Lee Shab says, thank you for answering my questions. You're welcome, Lee Shab. All right, let's get to the list here and keep going. So number 8, I love this exercise. Sit-ups. And really, I'm talking about a progression. When we're talking about the fastest ways to relieve back pain, remember all this stuff here is pretty quick relief, short term. This stuff takes slightly longer, but it's not fixing the root of the problem. Loosening up the muscles, loosening up the joints, the discs, all that with this sets you up to better activate the right muscles over here. And once you've got your lower abdominals activated and you figured out how to activate your glute muscles, then you're ready to begin versions of sit-ups. And I'll show you the progression here next so that you can try this at home if you have a back pain problem. And a lot of people they get to this point, it produces relief for much longer. Not only does it produce relief, but you can gain quality of life because you're going to be able to move better. You're going to be able to be more active. You're going to feel more confident in doing everyday activities. So the requirement here is that you've already figured out how to activate your lower abs. You've figured out how to activate your glutes. So then the next step is to challenge your lower abs in a sit-up. Now here's the first progression, is you're gonna push your back flat, activate your lower abs, tighten your glutes too, then reach your hands out towards your knees, bring your chin down to your chest like you're making a double chin, and then bring your shoulders up and try to touch your kneecaps. Keep pushing your low back flat, and that's gonna activate your lower abs a lot. You might shake a little bit here, hold it for 10 seconds, and then after 10 seconds, you can relax. Repeat this. I usually tell people to go 10 reps, but work your way up to, in a day, doing 3 sets of 10 reps, 5 sets of 10 reps, even 10 sets of 10 reps, spread out throughout the day, because that really activates and challenges your lower abs and boosts the strength up to fix the imbalance and put the right pressures through your spine. But you have to begin to feel better. You shouldn't be doing this if you're hurting. If you're having pain doing this, go back to the earlier things in this list and work on those things long enough to get yourself into this position where you're not hurting to do this. So just to review again, back flat, reach your hands out towards your knees, chin to your chest, make a double chin because then your neck can start to hurt. And then bring your shoulders up, neck down, hold it for 10 seconds. Don't let your feet float up. Keep your feet down. That's why you're going to activate your glutes. After 10 seconds, you can relax. The next progression, I'm going to show you 3 total. This is 1. Here's 2. Is you're going to put your feet down like this, push your heels down because that activates your glutes better. Turn your feet out, also activates your glutes better. Back flat, reach towards your knees still, chin your chest, come up and hold right here. And you can see I'm shaking, and I work on my abs consistently. This is not easy for anybody. After 10 seconds, you can come down and you will feel your abs work very well. Work your way up to this. Don't start here if you've never done ab work. This can be very challenging and potentially even strain your abs because it really puts a lot of pressure through your abs. But it should feel fine on your back, by the way. Like right now as I do this, my back feels great just working on my abs. Once you've practiced that, then you head into the third progression, which you're no longer going to hold. The holds, by the way, are great when you're starting out to make the muscle activate, get all the muscle cells to activate together to synchronize them, so that when you do the reps like I'm about to show you, you're getting a good contraction from the entire muscle and all the cells within it, right? So the next progression, you're going to use some momentum. You're going to raise your arms up, flatten your back, and then I'm going to throw my arms towards my legs and bring my chin to your chest, chin to the chest. Now I'm going to show you the full motion, but then I'll show you some easier ways to do it. And you touch your feet. And then when you come back, put your low back down first. Touch your feet, just like that. Now, if you can't reach your feet, that's okay. Just go to your thighs. Just like that. Just make sure that you're pushing your back down flat because that makes you use your lower abs. And once you can get to your thighs, maybe you can get to your knees. Maybe you can get to your shins. Maybe even the ankles after that. And then eventually you work your way up to your feet. And the whole time you're using your lower abs. Training your lower abs like this is gold for fixing the imbalance, to get your back muscles to relax. Because remember, in the imbalance that I'm talking about, the back muscles that run right here are being overused because they don't get any help from the glutes or the abs. But when you do this sit-up exercise that I just showed you, you're using the lower abs, tilting your pelvis, doing the posterior pelvic tilt. This part right here comes up higher. The glutes start to activate, so this back part comes lower. It straightens out your spine, your lower back right here. And then it forces you to use these lower abs to do the sit-up motion. And it's teaching your back muscles to relax, to say, your back muscles will essentially say, oh, abs are helping now. I don't have to work so hard anymore. And then when you go do your normal everyday activities, when you go walk, when you go take care of your house, yourself, your people that you live with, that you love, your abs are now active and they're involved in the motion. And it's not all back muscles having to do everything. And so they're not compressing your discs and your nerves and everything else back here so much. So you're saving yourself from back trauma the rest of your life. Long-term pain relief with this. All right. That is the sit-up progression. Hopefully that was helpful for some of you guys out there. All right, I'm going to get into a different color here next. Let's go blue for our last 2 points. And here we've got weightlifting. And here's the thing with weightlifting. If you have good abdominal strength, if you've got good glute strength, and you're confident that you can use the muscles on command, you've done some of the sit-ups like I've shown you, and you're pretty good at doing them. They're getting easier for you. That's the point at which you can begin to experiment with some weightlifting. Now, I didn't put a specific weightlifting exercise in here. I'm going to show you a couple that I like. But the point that I want you to take home from this video right now, from this talk, is that it is okay. It is actually necessary for you to eventually begin to lift weights, because you have to train your body to work within the right muscle balance as you're doing these weightlifting activities. And the weightlifting activities are very transferable. The movements themselves are very transferable to everyday activities that you might do at home in taking care of your home and yourself. So that's why they're important in my book. So let me show you some simple ones here with small weights. And I said weightlifting, and I think some of you guys might right away go to, oh my gosh, she's going to pick up 100 pounds from the ground or from overhead. And yeah, that could be something you get to later if you were doing that before. But why don't we just start with a small weight this is 5 pounds, very doable. So if you're practicing squats, for instance, and you make it a glute-driven exercise, not a quad-driven exercise, then you can get a lot of benefit for your back pain relief by doing this. You should not be feeling your back working a ton. You should be drawing in your abs. See how I did the posterior pelvic tilt? Draw in your abs, tighten your glutes, and squat with the glutes and abs in mind. If you're doing that with some weight, add more weight as you get better at it, and focus on using your glutes the entire time, which I'm not going to go into too much detail in this video, but I've got a lot of videos on YouTube and on Facebook that teach you how to use your glutes in weightlifting exercises so that you can properly do these and not hurt your back. And what I want to dismiss here right now is that these exercises, weightlifting exercises, potentially cause more back pain. I disagree. I think if you're not doing the movements correctly and you don't have good muscle balance, then yes, you're destined to get hurt because you're using the wrong muscles and your form is off. But if you have the right form, you're using the right, you feel the glutes working, you're consciously turning on your abs as you're doing this, and you're not overdoing it with the weight or the reps, you're working within safe boundaries that your body can tolerate, then it's good for you. But you should feel the right muscles getting tired in order for you to have the feedback that you're on the right track and that you're not going to hurt yourself, and that this is a productive thing for you rather than a harmful thing for you. Don't be afraid of the weights. I feel like I hear too many patients come back and tell me, my doctor said, don't pick up weights that load my spine because I had a back injury. Even for some surgeries, I tell people, yeah, I know your doctor said not to load your back, but now your abs are working right. Now your glutes are working right. How else are we going to strengthen those muscles unless we load them with some weights? And you're safely doing it, and we've added little tiny weights to begin with before we get to the big weights. We can gradually progress that direction. The question I always have to ask is, was your doctor into weights? Because maybe they don't know. Because I've met doctors, surgeons that are into weights, and they get this. They understand this stuff. They know that the body responds to the forces you put on them, and they can begin to put the mechanics together like I'm describing whenever they hear it. So it makes sense to them. But if your doctor isn't into exercising like I'm describing, they're going to be averse to it. They're going to tell you no on it. But you have to figure this out for yourself. All right, deadlift is this one. You're starting from down here. Push your knees out against your forearms because that activates your glutes. Suck in your abs right here, lower abs, because then you're bracing for your spine. You're protecting your back. And then when you stand up, tighten your butt muscles. So when you come down, knees out, suck in those abs. Abs should be in the whole time, butt tight at the top. Knees out at the bottom, butt tight at the top. If you're doing the reps like this every single time, even when you start adding more and more weight to this barbell, you will feel your butt muscles working the most, and you'll feel your abdominal muscles getting tired, getting a workout throughout. And what you should barely, if anything, feel is these back muscles running up and down the sides of your spine. They're usually not felt, or only felt if you really kind of think about it. But you should end the set of the exercise saying, whoo, I feel it in my glutes and my abs are working too. Same thing with back squats or front squats. I'm gonna do a front squat. You should be bring your knees out and hips forward, because that activates your abs, and then tighten your butt at the top. Like this. Let me show you the side view. I'm tucking my bottom under my spine to use my glutes. What you shouldn't do is lean your body forward, because that right away puts a lot of tension on the back muscles. When you lean forward, it makes you want to use these muscles to hold your body up. But if you tuck your butt under your spine, you force your glutes to be the main driver in the motion, and you're taking your back muscles largely out of it. You're making your back muscles work the way they're supposed to. Your glutes are so much thicker. They should be so much thicker and bigger muscles than your back muscles. So they should be driving the motion whenever you're doing these weightlifting exercises. Hope that makes sense to you guys. Whew, starting to sweat. You guys got me sweating here on Tuesdays. All right, final one. This is a good one here. What do you guys think it's going to be? Any guesses? Let me go to the comments here. And you guys just give a guess. Type in the chat. What do you think I'm going to say is number 10 here? I'm curious to know. Let's see how well you guys know me. Some of you guys have been following me for a while, and you probably can guess what I'm going to say. Kit Kat says walking. No, it's not walking. Come on, guys. Y'all guess. What do you think it's going to be? We're not going to need that. Thanks. Cynthia says invaluable information. Thank you. You're welcome. Glad to help here. Majaja Manik says walking. Nope, it's not walking. Come on, guys. Let's get another guess or two in here, and then I'll reveal what number 10 is. I should give a disclaimer. It's kind of walking, but not really. Not really. Walking's part of it, I guess. So you're not completely off, Kit Kat and Majaja. All right, let's go. I don't see any other guesses coming through. Sometimes they're delayed coming in. It is cardio. And here's the thing. Walking could be part of cardio, but when I think of cardio, it's not... Let me give you my definition of cardio. Cardio is doing an activity that raises your heart rate to the point where you feel your heart racing. Not super hard, but enough to where you're starting to sweat. You're working. Your breathing increases too. Your breathing rate. We got some more coming in here. Somebody else says, that was Majaja, walking. Kit Kat says cycling. You're on the right track. It's cardio, but it doesn't have to be walking. It doesn't have to be cycling. You could theoretically get your cardio in from weightlifting, because you start to get your heart rate up with weightlifting, right? If you don't give yourself a lot of rest breaks between the weightlifting, the sets and the reps, and you go from one exercise to the next, you could be dripping in sweat. Your heart rate could be very good in the burn zone. You're huffing and puffing like you're running, like you're sprinting in some cases. That is cardio. Now, holding a run or walking for time or distance, that's also cardio. Cycling for time or distance, also cardio. Using the elliptical, swimming, all the typical cardio activities. Rowing is another one. Playing sports where you're doing a lot of running, changing directions, all that can be cardio as well. But here's the thing. It doesn't matter which of those you do, as long as you're using your glutes and your lower abs. If you are consciously using lower abs and glutes, or you've become so used to using the abs and the glutes, you've strengthened the abs pretty well, you've strengthened your glutes through some weightlifting exercises, and you feel like you're consistently using them, 8 out of 10 steps, 8 out of 10 pedal strokes on the bike, 80% of the time in every cardio activity, weightlifting or traditional cardio activities, then you're on the right track, because what's happening in your spine, in your lower back, is you're doing small, subtle movements. You're not really focusing on stretching your back and getting into, back specific positions. You're doing the activity. You're doing the walking, running, cycling, biking, whatever it is, but it requires stability from your back. Your back has to hold stable, and it's doing small adjustments, small movements as you go through that activity. That's what your spine is designed to do. So you're making your back work the way it was intended to, but go into cardio having trained your abs and glutes. Let me say this differently. You shouldn't be focusing on cardio unless you've trained your abs and glutes. And this is the mistake that I want to leave you guys with that is commonly made if you have back pain, you're trying to get relief. There's a lot of people go straight to cardio when it comes to exercise. They start here. They might do some of this stuff here, but they'll think, oh, my back hurts, I should just start walking. My back hurts, I should just start on something easy, the bike, get on the elliptical, just start moving somehow, some way. But you're shooting yourself in the foot. You're going to move backwards because if you haven't put in the work to get your abs and your glutes to work and get the strength up high enough to use it while you're doing whatever cardio you choose to do, then by default, you're doing the cardio exercise with the wrong muscles. Therefore, you're training the bad muscles, the wrong muscles, the muscles that feed into the imbalance and end up putting more compression through your discs and your spine and your nerves, and it makes the back pain problem worse over time. Don't make that mistake. Don't start here. Face the hard thing, the thing that everybody wants to avoid, sit-ups, ab activation. They don't want to do it. I meet so many people that I start telling that we're going to work on abs, and they're like, oh, okay, I've been avoiding it, but I guess I should. Some people will do it, and they'll say, yeah, I've been working on my abs. And then I'll highlight to them, have you felt your upper abs working more or your lower abs working more when you do ab exercises? And if they don't know, I'll say, show me how you do ab exercises. And they'll do it, and they'll say, oh, it's been upper abs I've been working, not lower. You need to face that. You need to figure it out. If you don't figure that stuff out, you're not going to resolve your back pain. And you're going to be going backwards instead of going fast into the right direction. Hope that helps you guys. Cardio is last here, okay? Start with this stuff to get some short-term pain relief. Only go into pain medication if you have to. Let me put a red box around it here. Only if you have to. This stuff, let's put an orange one here. This is absolutely necessary right here. Work on this to get stronger. And then you have to earn all of these, and you have to go through all these and earn the strength here in order to be able to access the weightlifting and cardio safely. Don't go here first. A lot of people make the mistakes of starting in these areas, especially cardio. This is where you want to start first. This can give you some short-term pain relief. This is a long-term pain relief right here. All right, guys, with that, let's get to comments for a little while here. And then I'll last with you guys as long as I can here. We'll see when they pull me out. How's everybody doing here in the chat? Let's get in here. Bobby Van Thune. Your message didn't come through. Send something in. Who else is here? We got Michael McQuaid, back pain / nerve entrapment with chronic Lyme's. I'm so sorry. Lyme's disease. Hopefully you're getting some treatment for that. But I would also consider, are you getting compression in the back because of a muscle imbalance? You got to fix this stuff. Paul says, what about years, decades? Maybe I'm missing context here. I'll see if I can find something a little bit earlier. Let's go back, way back, and see where you guys are all at on questions. All right, here's where we were. Valerie Lovey says, cold and heat, give me some relief. Do you recommend this? Yeah, you can use cold or heat, but it's kind of in this family. I mean, it's not pain medication, but I'd say it's in this family. The reason why it didn't make the list is because it's not as instantaneous as some of these things are. It might take you like 15, 20 minutes of using the cold and heat. You might need to cycle through cold or heat. You might need to try cold and see that it doesn't work, and then try heat, and then that one will work, or vice versa. Some people start with heat, doesn't really work. Cold works better. Some people alternate. There's just a bigger learning curve for ice and heat, in my opinion. But then it doesn't even soften the muscles like massage gun does. It doesn't stretch out the muscles like stretching does. It doesn't offer support you can take with you like the back brace. And hanging just decompresses things. So there's a lot more mechanical input into the spine by doing 1 through 4 here. Cold and heat, not as much. So it's not my favorite thing to do, but it's not bad. If you wanted to put an ice pack or a hot pack on your lower back, you could do it. But just realize that it's short term and it's not as impactful as these treatments up here. It's a good question. Good. Thank you for that, Valerie. Another one from Facebook. We got Gina Blonde F. I've been diagnosed with lumbar spondylolisthesis S1L5. The x-ray looks scary. Mine's mild. Scary or scary? Mine's mild. Level 1, 2, started your recommended lower ab and glute strengthening. Awesome. I'm finally just about pain-free and numbness has subsided. Big help. That's awesome. Fantastic news, Gina. I tell you guys, those of you guys that are on the fence or wondering or maybe thinking about this and saying, well, he's not recommending, this other special back thing that everybody else says, because this is what works. Gina's proof here. Abs and glutes are going to give you the longest term relief. We're not into short-term fixes here. We're not into gimmicky fixes here. We're into what's going to truly impact your situation and help you get rid of this problem forever so you can avoid surgery and get back to the things you want to do. So good job, Gina. Thank you for that, Gina. I appreciate your help in sharing your story, and I'm glad we were able to help you out. Helen Kingsbury says, can lower back issues cause nerve pain in the leg and groin? Absolutely, yes. The nerves that come out of the lower back go into your legs. They go into the groin area as well, and some of those nerves go all the way to the tips of your toes. So it's very possible that if you have a foot or ankle problem, we have to consider the back. I can't tell you how many people I've seen with plantar fasciitis, which is heel pain on the bottom of the foot, it's actually a sciatica-related issue. And we're treating the back and the hips instead of the foot. I'll still do some treatment of the foot, but heavily focusing on the back and the hips, and that resolves the heel pain because of the nerves that run down from the back into the feet. So yeah, absolutely, it can cause leg and groin pain as well. Rini CG says, is inflammation curable on the upper and mid back? Yeah, inflammation is not a bad thing. The medical field and the drug companies make it out like it's a bad thing, but inflammation is the first step in healing. It's necessary. The point of inflammation is to bring in special cells in your body to the area that help to heal things. And we see it as a bad thing. The thing is, if you don't take away the aggravating factor, whatever that is in your body, then you keep getting inflammation. And we're mistaking inflammation as a problem when really it's some other aggravating factor. In other words, if I kept scratching your skin right here, you could take it for a while, but after an hour of this, after a day of this, you would be irritated and inflamed there. It would be red. I might even cut your skin open. And the reason why it gets red is because there's cells, special white blood cells and other things coming into the body, histamine, that are trying to heal the broken or damaged skin. But if you don't stop doing this, you could say take an anti-inflammatory medication and that might help, but really it's the finger scratching. It's the aggravating activity that's messing things up. And if we take that away, then your body has a chance to heal. When it comes to back pain issues, upper and mid back problems, it's the muscle imbalance that are aggravating the spine. And the inflammation is a byproduct of the aggravation. So what we have to do is fix the muscle imbalance. We can't just take medication. We can't take anti-inflammatory medications indefinitely. That's not a good solution. That's for the short term. We have to take away the assaulting, traumatizing activity. That's like the old cliche of the doctor saying, well, stop doing that thing. But you don't know in a muscle imbalance. You don't know that your abs aren't active or that your glutes aren't active. That's what I'm trying to make you guys aware of. Go get better ab and glute activation, and that's going to take it's going to put the muscles back in the right balance. It's going to take pressure off the spine, and you won't feel like you have inflammation. You can't just take away your inflammation. We have to fix the muscle imbalance. Trying to say it different ways as much as possible for you guys to understand. Gina says me as well. Rini says, I used a pull-up bar on the doorway and it helped me 90%. Yeah, it can make a big difference for a lot of people. And you don't have to, in case you guys are thinking of doing the hanging exercise that I talked about, number 4, and you're like, oh, I'm too heavy or my grip's too weak and I can't hold myself up. You don't have to dangle your full 100% of your body weight. You can go like 10%, 50%, whatever percent you can comfortably go, and it will distract. It'll take pressure off your discs, off your spine, and it can feel tremendously better. Some people even get a pop or a click in doing that. You can kind of wiggle around there, just be safe with whatever pull-up bar situation you have. Like if it's the one that goes in the door frame, it may not be that sturdy or that safe. Depends on your door frame too. So just be mindful of that. Rini says, pull-up bar release a lot on my lower back. Yep. I'm so glad I helped you out, Rini. Michael McQuaid says, do you have any ideas for nerve entrapment in the lower back and glutes? Yeah, there's a lot. I would always come back to what's happening in the low back. So the muscle imbalance, number one thing that's going to entrap the nerve in the space where the nerve comes out of the spine, the foramina, the nerve root comes out of the foramina, the foraminal opening. And so you need to think about depressurizing that area. Now, there's other places where the nerve can become entrapped, but most of the time, those are secondary. And we don't have a lot of certainty as to where exactly the nerve is entrapped. There's a lot of medical professionals will say, oh, your nerve's entrapped behind this muscle or around this joint. And they're guessing. They're really guessing. There's no certainty. I personally find that fixing the root muscle imbalance, the way that the muscles are distributing forces through your body, is the most consistent way to reduce overall nerve tension and create the right forces and pressures throughout the body. And if you get hung up in a nerve entrapment in some specific area of your body and it doesn't seem like it's related, this is basically the one thing that you can do that's going to knock over the most dominoes. It's the whole, killing 10 birds with one stone. Fix the muscle imbalance and then see what's left after that. I'm willing to put money on that. You're probably going to feel better, possibly even 100% better. Don't worry about little crazy entrapments. They're out there. Medical professionals talk about them. I talk about them with my colleagues sometimes, and I can't tell you how many patients I've seen that have come in saying, yeah, my sural nerve is entrapped in my lower leg, and I have to do sural nerve exercises and sural nerve mobility routines, and I have to get a tennis ball in there. And then I look at their SI joint, which is right outside their low back, and their lower back, their L5S1, focus on that, and it fixes their sural nerve problem down their leg. And I never touch the lower leg. Fix those muscle imbalances, guys. All right, next up, Mulier Bellator says, does hanging upside down widen the space between the thigh and the hip joint for arthritis? So I'm thinking for hip arthritis. Yeah, it can also traction the ball and socket joint of the hip. Absolutely. And I think it's not a bad thing to try. It's just that you can't live like that. You can't live hanging upside down. And it is going to have more of an impact being on the inversion table, in my opinion, than hanging. However, hanging is still good, but it doesn't fix the root problem. You still have to go back and get the glute strength and get the abdominal strength in order to resolve hip osteoarthritis, guys. You still have to fix the muscle imbalance. This is the stuff that you just can't avoid. You can do this in the short term. You can eventually get to this, but people like to just hang out in these two areas and this one for sure, and they skip this. And it's hard, especially if you're an active individual who has a history of being in sports and things like that. It's hard to slow down and think about which muscles you're firing and do these little easy exercises, which don't usually end up being easy for a lot of people, even the high-end athletes, people that have been doing, professional level or collegiate level sports. They struggle with this stuff. They love this and they can do this very well, but they're doing it in a compensated way because they've never figured this part out. So go figure that out. Hanging is potentially going to give you some short-term relief, guys, but not long-term. Michael McQuaid says, I can't do the hanging, waiting on shoulder surgery. Thank you. Yeah, there's definitely going to be some limitations. So you could, if getting some traction on your back's a big deal, the inversion table could be an issue, but it's one of many things that I recommended here. There's other things you could probably try. Gina says, I hang from the top of a doorway. Awesome. Cindy Castillo. Hey, Cindy. She says, hi, Dr. David, watching and working. Awesome. Thank you for joining me. I appreciate it. Hopefully we can help you out. Moulier Bellator says, thank you for explaining about ibuprofen. You're welcome. Yeah, it's dangerous. Watch out, guys. Just be very careful with that stuff. They make it seem like it's easy, it's over the counter, but there is some serious risks with it that we all overlook. I mean, it shocks me that people are more afraid of swimming in the ocean than taking ibuprofen. When, if you look at the numbers, you're way more likely to die from ibuprofen than swimming in the ocean. Or getting struck by lightning too. Like, that's super rare. But we run inside when the thunderstorm's here. All right, I am Bell. I'm sorry, I can't read your name. I am Abhishek Kundu. Says my cardiogram reports there is partial thickness defect seen involving articular cartilage of patella, measures 1.3 centimeters, reaching to subchondral bone, grade 3 overbridge classification. Yeah, I remember you were talking about you had grade 3 chondromalacia patella. So yeah, it's the imaging that you got there, the cardiogram. I haven't heard it called that, cardiogram. Your cartilage imaging is consistent with what I was telling you. You would still need to loosen up the quads, work on glute activation. Abdominal activation is going to be important too, so that you're not overusing your quads and smashing your cartilage. And even though it's to the subchondral bone, as you wrote here, you still have a shot at healing it. Cartilage can heal, but you have to take that pressure off. It's like what I was saying earlier. If you don't take off that aggravating factor, you're going to continue to worsen. If you take that pressure off your kneecap by freeing up your quads and beginning to use your glutes more, you might even have to look at foot exercises. It's, by the way, I highlight everything you should be doing for cartilage problems like chondromalacia patella in the patella pain recovery program. We have a program that walks you through everything step by step, phase by phase, so that you can allow your cartilage to heal and you're not dealing with chondromalacia patella. And most importantly, you're preventing setting up a meniscus tear or a arthritis situation in your knee later in life by learning it now at this point when you're just dealing with chondromalacia patella. So I highly encourage you to go check out our patella pain recovery program to fix this chondromalacia problem that you're writing to us about here. You have another couple of comments here. I'm 28 years old, and earlier I used to be an athlete with good muscle strength, but I used to overtrain sometimes, which is probably why I got this injury. Yeah, especially if it was quad dominant exercises. Now I'm following the cartilage healing plan you gave me. So how long will it take for my injury to heal? It depends on how severe your muscle imbalance is, honestly. I mean, given that you're 28, you said you've been working out for a while, and you've had good muscle strength, as you wrote here. You probably have a lot to undo. But at the same time, you probably have a lot of potential to improve fast if you can focus on working on those glutes and follow the plan. If you get those glutes working very, very well, you're going to resolve this issue pretty thoroughly. So stick with the glutes. Get obsessive about getting your glutes active. Figure out how to use your glutes while walking. Figure out how to use your glutes in all exercises. Don't use your quads. Your quads, let me put it to you this way. Your quads will be used, but don't intentionally isolate the quads. Don't look to activate your quads or to exercise your quads, because you're going to then feed into the problem. Make your quads work secondary to your glutes. Like when you start doing little baby squats and eventually get into deeper squats as your glutes control it, your quads are going to get activity. Your quads are going to be used. When you walk, you have to use your quads. But if you make it a glute dominant walk, you're no longer making your quads work all the time. So they're not going to get as stiff and they're not going to put as much compression through your kneecap. So you're saving your kneecap and you're allowing the cartilage there to heal again. I hope that helps there. Back to Michael McQuaid. I don't know how not to take NSAIDs, naproxen, no stomach trouble. Oh, you're You're one of those that just has no trouble. Yeah, you got to watch out, because then it all of a sudden can creep up on you if you're taking it around the clock. You've got to fix the root muscle problem so that you're not relying on pain medications. Some of you guys are just so used to it. It's like you live on it. I've had people tell me I felt tired, so I took a Tylenol. That is not a reason to take Tylenol. Tylenol is a pain medication, not a fatigue pill. So just pay attention to what you're feeling and assess, do I really need this or not? Are you just in the habit of using it? Next question is about Tylenol. Yeah, Tylenol can cause some side effects as well in your kidneys and other organs as well. Paul says, what about years, decades? I'm not sure what that's in reference to. Valerie says, I use Absorbine Junior. I'm not sure what that is. I haven't heard of that one. Michael McQuaid says, back pain, nerve entrapment with chronic Lyme's. I got to this comment earlier. And then we have Sina Lualai. I can't pronounce it. Hello, Dr. David. And thank you so much for sharing your videos. And I love watching them, but I'm trying to do all the exercises that you're sharing because I have knee problems and my lower back too. Great. I'm glad you're watching the videos and doing the exercises. Just keep in mind that, like with this list that I gave and with other lists that I've given for exercises, it's not a list that you would do all in one day or even all in 1 week. Oftentimes, not even all in 1 month. If we're talking about the 10 fastest ways to relieve back pain today, you might do 1 through 4, possibly 5 for like a month, maybe 2 months. And then you should be working on 6, 7, and 8 for probably another 2 or 3 months. Very often, that's how long it takes. Some people go fast and they'll do all this in a month. But then the weightlifting and the cardio can still be weeks and indefinitely. So this whole process can take anywhere from 3 to 6 or even 12 months to go through this and fix a back pain problem. And just keep in mind that most of the time, if you go to the doctor for back pain and you have something serious like a herniated disc, arthritis in your back, sciatica problems, degenerative disc disease, if it's your first visit to the doctor and they do an MRI or an X-ray, they're probably going to recommend pain medications, maybe prescription strength pain medications. And if it doesn't get better and you go back, they'll have you back in a month or 2. So there's 2 months. Then they might recommend an injection. And then if that doesn't work better, in another month or 2, you come back, there's 4 months on the high end. And they might be talking to you about potentially having a surgery at that point. It's only been 4 months. And I'm telling you, this takes 3 to 6 months on the low end, 12 months on the other end. So this doesn't fit the time frames that doctors give you. So those of you guys that have been going to the doctor, they might be pressuring you into surgery a lot sooner than it takes to do this stuff. So don't be surprised if you're working on this and the doctor's like, well, why aren't you better yet? They only authorize physical therapy for a month or 2 at a time, maybe 3 if you're lucky. It's not enough. This stuff takes you several months, the better part of a year to properly implement. So take your time and be okay with not being rushed through this process. All right, we got time for a few more here. Mueller Belleter says, hopefully there is not a lot of fat in front of the abdominal muscles yet. Well, that can stop. That can stop your progress for sure. I need to get a swig of water here soon. I think I left my water in the other room. Do you work with people directly? Says Lee Chab. Yes. In our programs, we do group coaching calls. I teach the program, some of those group coaching calls. We do have a way for patients to come and see me in person as well. Go to our website. You can call our clinic as well, our office, and we can talk to you more about that. Rini CJ says, my trainer had me do that one standing up. It was difficult. I wonder which one you're talking about. Lynn Stinson, 830, says, this really works. I've been practicing activating my lower abs all day and slightly tilting my pelvis forward when I walk. Amazing relief, and I've suffered for years. Thank you. Yeah, it's almost like people, I've had people tell me like they feel very surprised to learn how simple this was. Like it's been under your nose the whole time. It's been under all the medical profession's nose for the whole time. But we've gone through all this crazy gadgets and medical devices and surgeries and medications and all these scientific breakthroughs just for somebody to tell you all you have to do is tilt your body this way, activate these muscles, get them stronger, your pain's going to go away. It is that simple. But we don't figure this out. We wait a long time, and we go through all this medical stuff when we don't need to. It's unnecessary very often. You just have to figure out lower abdominals, glute muscle activation, and then get stronger. Go through a progression to then use those muscles in your everyday activities and eventually exercises as well. Good job, Lynn. Glad it's working for you. Congratulations. Michael McQuaid says, ART therapy for nerve entrapment in lower back, upper glutes, ? Extreme pain. Yeah, I know ART therapy. That's where they're pressing on you and then you're doing certain stretches. And, you can get some short-term relief from this. It is not correcting muscle imbalances, though, because muscle imbalance correction requires you to activate the muscle so you have conscious control and then to get stronger over time. I'm not saying don't do ART. I'm not saying it can't be helpful. You might get some benefit out of it. You might loosen things up. It's, for me, impactful in that it's got massage-like benefits. But to truly say that it's unentrapping a nerve, I think is not, we can't know for sure. Maybe it is, maybe it isn't, though. To keep that nerve from being trapped long-term, you need to fix the muscle imbalance. So just think that through. And I think I've talked to a lot of ART trained people, and they're not usually incorporating exercise into their treatments. They're very often just doing their aspect of it, their hands-on part of it, because that's kind of their specialty, their thing. And I'm not saying that they're not good to see. You can go to them. I think it's fine as long as it's not hurting you. You feel like it's benefiting you, but it's up to you to decide how much of it do you need. And at what point are you kind of done getting the short-term pain relief stuff, and now you need to be working on the long-term pain relief stuff, and that needs to be more of your focus. So think that through, Michael. All right, Gina says, yes, learning glute activation has saved my knees as well. It's a big deal. You got to get those glutes active. Glad you're benefiting. Backroad Motobuilt says, got told I have a posterior inferior labral tear today. Saw you were live, and will I need surgery? My primary hasn't informed me yet. Please DM or mention on stream. Happy holidays. Oh, thank you. I appreciate that. Sorry to hear that you have a tear. That sounds like a meniscus tear that you're dealing with. And it's hard to know for sure, just off of a comment here on the internet, if you're going to need surgery or not. My advice to you would be, before you go into surgery, don't quickly jump into it. Go fix muscle imbalances. Go find our meniscus videos. Go check out our meniscus tear recovery program. We have a program for that. It's been very popular, actually, and it's very successful. It helps people fix a root muscle imbalance, working on certain muscle groups that need to be improved to take pressure off the meniscus in the knee. And then you can give your meniscus a chance to heal, and then you can determine if you still need surgery or not. Worst case scenario, you fix the muscle imbalance by going through that program, and you still need surgery, but you're going to enter the surgery much better off because you're going to be stronger. Your muscles are going to be in the right balance. That should help you to recover faster and prevent you from needing another surgery later on because you re-injured it. Best case scenario, because that was the worst, best case scenario is you solve the pain 100%, your meniscus heals 100%, and you never have surgery. I don't think you can lose. I think you're in good shape either way, whether you do really good with it and it helps you, or it doesn't help you, but you still fix the imbalance, you're going to be in a good spot. So I strongly believe in your situation right now, I wouldn't go into surgery right away. I would give yourself like a solid 2 months of working on our program, then make the decision on how you want to proceed based on how you feel at that point. Good question. Wilma, is it normal for the glutes to get sore after a series of glute exercises? Absolutely. You can get your glutes sore, and that's good. That's a good sign. That means you're working the muscle, and the muscle is going through the process of getting stronger. That's going to help you long term. So good job on getting those muscles sore. I don't think people should have pain or discomfort going through any of these exercises except for muscle soreness. That is a good sign. I would take that as feedback that you're on the right track. Good job, Wilma. All right, let's get a couple more comments in here, and then we got to go. Medical coding conference. I have L5S1. I have an L5S1 and have been doing bird dogs, etc. And that may explain why I'm having no progress. Yeah. Bird dogs are exercises where you're in your hands and knees, and then you pick up an opposite leg, opposite arm, and you sometimes hold it. Sometimes you just alternate other leg, other arm. And the point is to work out your back muscles. And this is a very commonly done exercise in physical therapy clinics, and other medical professions as well, for back pain problems, but it's focusing on back muscles, which I said is not a good idea. So you got to work on the abs and glutes. I did not put anywhere on this list to work on your back. In fact, I even cautioned you against using your back muscles in weightlifting. You shouldn't be feeling your back working in any of this. And you're trying to relax your back with the massage gun stretches and the back brace and hanging. You're trying to get your back to stop being used so much. And then that sets you up to use your abs and glutes better. You see the principles that I'm trying to paint here with the recommendations that I'm making? Back exercises make back problems worse. I will take that to the grave. I don't care how many medical professionals out there will throw research at me and say, what about this? What about that? What about your patients that are hurting? What about are you going to go to the grave saying, I follow the research even though it hurt my patients? Not cool. Not cool. It's not going to hurt more and then get better one day. That only happens if you had a surgical incision done because you had a controlled trauma to an area of the body where the surgery was done. Therefore, you're healing. You had trauma to the area. So yeah, that in that case, it's going to be worse before it gets better. But if we're trying to avoid surgery and no surgery was done, no trauma was done to the area, we're fixing a chronic issue, then it should be feeling better and better and better as we go on, with the occasional hiccup of, I overdid it, I slept wrong, I twisted funny, but nothing that is forcefully, intentionally hurting. That is not a good thing in my opinion. So stop doing bird dogs. Glad you figured that out, medical coding conference. Then she said, what about doing bridges? Yeah, bridges are a much better option because that's going to be strengthening your glutes. Just make sure before you do the bridges that you know how to activate your glutes and your abdominals, because it is possible for you to do bridges and you're not using your glutes and abdominals very well during the bridge. Then it's an unproductive exercise for you. Bridges, don't assume that all bridges are good. You have to do a glute focused bridge, holding your abdominals in the picture, like making sure your abdominals are working there too, which I talk about in a lot of videos on YouTube and Facebook. Leonam 3262 says, you are very talented ad professional. Bravo. Thank you. Oh, thank you. I appreciate it. I'm glad you're benefiting from this. Mulier Bellator says ballet. What about ballet? Ballet. Oh, maybe we were talking about posture. That might have been at that point. Ballet is like a very posture driven appearance, performance, sport activity. So that might be why you mentioned that. Thank you. You're here like a star. Very talented. Oh, thank you. I appreciate that. Lee Shab 84 says, with the lumbar stenosis and hip arthritis, which of your programs do I do first? Oh, that's a good question. So we have a back pain recovery program that would be best for stenosis. And then we have a hip arthritis recovery program that would be best for hip arthritis. I would not join both. What I would do is figure out, you need to determine which of those two problems is worse. If it's your stenosis, then join the back pain program. If it's the hip arthritis, then join the hip arthritis recovery program. Here's the thing, both programs will help each other out in both body parts. In other words, if you end up in the hip arthritis program, you're still going to get benefit for your back pain issue, for the stenosis. And if you end up in the back pain program, you're still going to get benefit for your hip arthritis, because we're focused on solving muscle imbalances, which help the joints above and below. So we often have people in our hip arthritis program that say, I had back pain and it's getting better. I had knee pain and it's also getting better. And they're in the hip arthritis program. And then we have people in the back pain program that say, I have hip problems and it's getting better. So you're going to benefit either way. Pick the problem that's worse for you and join that respective program. Valerie says, thank you, doctor. Heart, heart. Oh, you're welcome, Valerie. Glad we can help you out. Frank says, got pain in buttocks when sitting. Tried everything. Pain when sitting. Please help. I'm so sorry, Frank. There's a lot of reasons you can have pain in the buttocks when sitting. It could be as serious and complex as maybe there's a nerve issue. You have a spine, like a vertebrae, a nerve issue that's sending pain into the buttock area. The part of the buttocks you have pain in is a big question mark too. Could be an SI joint problem. There's big joints right below the spine where the tailbone is, the sacrum. And that could have something to do with the way that you're sitting, the cushions that you're sitting on, or no cushions. It could have to do with a lack of glutes in the area because you haven't been using glutes. You have a big muscle imbalance, but the lack of physical cushion on the backside of your body could be compressed in the area. It could be you're sitting on your wallet. It could be a lot of things going on here. You need to reason through this and figure this out. I can't just help you with just pain in the buttocks. This is not enough information. You got to give me some more, Frank. I'd love to help you out though. Bonnie Noble says, how about TENS unit for pain? TENS unit can help out temporarily. It's a good alternative to taking pain medications. TENS stands for transcutaneous electrical nerve stimulation. And it's where you put the electrodes on you and it's hooked up to a little machine. They sell these on the internet or at the stores now. And you turn on the intensity and it starts to buzz. And if you turn it intense enough, it makes your muscles start to work and flinch like this. And that can help with pain, but really only when you have it on. It's not going to solve the root problem. So it's okay to use. And if you don't want to take pain medications, that's fine. But I would rather you do these. Get a massage gun instead. Get a place to hang, like a pull-up bar or an inversion table. You might try a back brace first, and even just doing some stretches that doesn't cost you anything. And you can usually get some better relief than using the TENS machine. But it's not bad if you want to try it out. Okay, almost done here. Thank you for the information on the program. My goal is to move from D to an A or B grade. Yes. Come on, let's make some progress here. As I can't pronounce that. I feel encouraged the few times I've watched. Thank you from Arizona. You're welcome. Glad that you're encouraged. All right, last question here. Doesn't sit-ups compress your lumbar vertebrae? Good question, Janice. If you use your lower abs, you're actually taking pressure off your lumbar vertebrae. Let me bring the skeleton over so you can see this because it's hard to conceptualize. And I've had talks to my media team about this because I wish we had a good animation, but it doesn't exist. We might need to develop it somehow in our own office here. But here you can see the spine from the side view, and you have the rib cage here in the front, and you have the abs here in the bottom. When you do that posterior pelvic tilt, where you bring the front of the pelvis upwards, that hip thrust motion, you yank the backside here down, which pulls open the spine. I hope you can wrap your head around this. But the best thing to do is to try to feel it. Let me adjust the camera and see if I can show you my back here. So yeah, that's good right there. I'm gonna take your comment away for a second. Think of my back here, right here. So if the more I arch my back, the more compression I put into it. But when I suck in my abs and I flatten my back, I take pressure off the spine. It's kind of counterintuitive. And so when you're doing sit-ups, if you're using your upper abs a lot, let me show you my curvature in my back. It's possible for you to keep a curve in your back because your low abs aren't working and still curve up here, curl your upper part of your spine and use your upper abs, but you're still sticking out your stomach here, sticking out your butt and putting a big curve in your back. That does compress your spine. But if you're using your upper abs and lower abs, now you've decompressed the spine. You're taking pressure off by bringing the tailbone down, which pulls L5 and L4 down with it. So I hope that makes sense for you there. Who was it? Janice. All right, guys, that's all the time I have for today. Thank you all for joining me here on YouTube and Facebook and Instagram. I will catch you guys this time next week on Tuesday. Those of you in the United States, happy Thanksgiving. Enjoy this time with family and friends. Take pictures so you have those memories. Have a wonderful day, guys. Bye-bye.